surprised, Hussein, that it's one of your favorite students, although we don't pick favorites in bird, but I know Anan Amro has a special place in your heart.
Well,
he's from Palestine, the city of Bethlehem. He graduated from his general dentistry 2014, and he didn't waste any time because soon after that he joined the bird courses. He started with the implant course, and then he finished the cosmetic and restorative course in Amman, Jordan. He's also our ambassador in Palestine. He's the head of the committee that all the courses that are run in bird. So he's someone young, passionate, driven, with a head of beautiful dentistry. He's going to show us a full smile makeover. But not only that, he's apparently very good in business too. So what do you think? Do you have something to add more to him?
no, definitely. The good thing about our good friend Anan, he's one of those, another very passionate colleague, and he was one of those who came and joined the cosmetic diploma in Jordan. So he would travel 8 times every year from Palestine to Jordan. But not only that, because a lot of people do that, he decided he doesn't want to waste time. So at the same time, he used the implant diploma in Jordan. So in fact, he would spend 16 trips every year from Palestine to Jordan. When we say Palestine to Jordan, we're talking about taking a taxi, going through the borders. So 3-day module, 1 day before, 1 day after, 5 days every module, multiplied by 16. And that's what made him very unique.
Doing 2 courses at the same time.
Exactly. And he was doing so good. But then for Anan, sky is the limit. So he decided to bring Bird to Palestine, and he's now our Palestine representative. So he started this year our cosmetic diploma in Palestine in collaboration with Jerusalem University. I think without any further delay, we should introduce him and get him to talk to us about his passion, about his clinical cases, because I think our audience are in for a great treat from Anan.
I can't wait. Anan, the floor is yours.
Thank you, thank you. Can you hear me?
Yes, we can.
Okay, okay. I don't know what to say about everything you said about me. Thank you, Dr. Hassan. Thank you, Dr. Victoria. Thank you, everybody here, for allowing me to share you and to join you and this beautiful forum. So, okay, is it interrupted or something happened? Can you hear me, guys?
Yes, yes, we can hear you.
Okay.
You can just start by sharing your screen.
I will share my screen. Okay. Okay.
Perfect.
Okay, good. First of all, I want to introduce myself for all of you. My name is Dr. Anan Amro. I am from Palestine, from the city of Bethlehem. I have a center here in Bethlehem, Jordanian British Dental Spa. Many people ask me, why did you name it as Jordanian British Dental Spa? Because I took my certificates from Jordan by Bird Academy, and also from United Kingdom, which was a connection between Jordan and Palestine, and also United Kingdom. So I named it as a Jordanian British Dental Spa. Okay. As I said, I am from Bethlehem. Bethlehem, famous with the Church of Nativity, where all of people, Christians from all the world, come here and visit us. So after we finish COVID-19, I hope everybody, all of you, to visit us in our city, and also our capital, city of Palestine, Jerusalem. which and I will be there, and I am sure that you all will have a great hospitality here in our country. As I said, I'm working in my center, Jordan British Dental Spa. This is my beautiful team here, and this is Dr. Iman. She's my wife, whom I met in bird courses in Jordan, Amman, and she is my wife now. And this is my team in my center. My story with bird started when I met those two guys, Dr. Tamer and Dr. Hassan. Those I can name the heroes or the godfathers for me in implant dentistry and cosmetic dentistry. Those guys, they give me the passion, they give me everything I wanted to know about dentistry, anything I want to induce my dentistry. And of course, I will never forget Solange. Sola, I'm sure she's here now and watching me. I want to thank all of them because of them I am now what I am now. So this is me doing my first implant and supervised by Dr. Hassan, whom I learned from him so many things in implant dentistry. And this is me with Dr. Tamer and Dr. Wolfgang when I took my certificate and celebration of my graduation from both courses at 1 year. It was in 2015. I finished the implant course and the cosmetic course with Bird Academy. Okay, let's start with the presentation. Before we start with the presentation, as you said, Victoria, that now I am the representative of Bird Academy in Palestine, and I'm so happy that at this year, 2020, we started our program in Palestine. It's a professional diploma in cosmetic dentistry in collaboration with Jerusalem University, Al-Quds University here in Palestine, and this is our first group. And I miss you guys. I hope to meet you soon after we finish this quarantine and overcome the COVID-19. Okay, let's start. This beautiful lady came to my center and she said, Dr. Anan, hi, I can't smile because of my gum. Well, when you take first look for her smile, you will get shocked. Oh my God, there's a disaster happened here. What is going on? What should I do? She said, there is a food stagnation, there is a bleeding when I'm brushing, there is a bad smell. I hate my smile. So in such cases of, full mouth rehabilitation or smile makeover, I prefer to follow, I can name them as 10 rules. For me, what should I do? The first thing I should do is to listen. To listen, listening is very important because listening from the patient will build the trust between you and the patient. So if the patient trusted you, you will feel comfortable during the treatment. The second thing is thinking. We should always think positive. It is a mission. For me, it is a mission. Maybe it's impossible for many guys, but for me, it's a mission and it is possible to do. So I will think always positive. The third thing I will follow in my practice, it's evidence-based. Evidence-based, I learned a rule from Dr. Hassan. He said, in God we trust, anything else show me or give me the evidence. So anything I want to do, not only in my practice, in my life also, I will follow the evidence because it is important to do anything correctly, in the right way, and evidence-based. The fourth thing is the study. The study, as we know, you can do for cast model test, you can do X-rays, panoramic, CT scan, we can do periapicals, we can make a DSD for this case. So we start studying this case. Motivation. Motivation, we should motivate the patient to induce her oral hygiene, and also motivation for myself that I can do this case. I can do anything I want in this case. So motivation is both for me and for the patient. Expectations. As we know that there is a lot of patients nowadays, they have high expectations. So it's good when you're listening to the patient, okay, to know what's her expectation. So in this case, when I asked her about her chief complaint, she said that she hit her gum. She can't smile because her gum. So I should follow steps to make the expectations possible, and for me and for the patient. Plan and target, of course, we should make a plan to reach our target, and of course, then we will start within the plan we put, and of course, teamwork is a must. Teamwork is a must to get a success for anything in the world. So in this case, there is a teamwork between me and the staff, the assistants, the lab technician, and also I can take consultation from specialists, as I do with Dr. Thamer and Dr. Hassan a lot. So teamwork is a must to finish and take the final result. All of these rules, I am sure if we followed, we will accomplish our mission and we will finish it with a great success. This is rules that I follow in my practice, in my center, and in my life. Okay, when we see the smile here, we will start by examination and diagnosis. Let's check the clinical findings. We can see asymmetrical. Okay, we can see asymmetrical smile. Okay, we can see an old bridge. We can see gingival recession. We can see a gummy smile, a huge gummy smile. We see an over-eruption this side. And of course, there is a loss of vertical dimension. Let's move to the X-ray. For the X-ray, we can see that there is periapical lesions, many periapical lesions. We can see periodontal lesions. There is pocketing. There is bone loss. There is tooth loss. And there is tilted teeth. And we also see old restorations. So we can study the case step by step. Take your time and start your job. When we put the treatment plan, we should know that any comprehensive treatment plan must be established prior to the start of the treatment. You should know what you are going to do. Don't start without, okay, any case I do, I imagine the final result. If I didn't imagine the final result, I will not gain the success. So, as I said, communication between me and the patient and education for the patient essential in order to match the dentist and patient's definition of success. The success is gonna be reached by communication between me and the patient should know everything. Each step I will do, the patient should know. So in this case, I put 5 phases to complete this mission. Phase 1, as I said, education, and I assist on education because it is the perfect way to make a good trust between you and the patient. Of course, periodontal treatment, and phase 2, we will do the surgical treatment. Phase 3, we'll do endodontic treatment. Phase 4, we will do initial preparation and the temporization, and the final prosthesis in Phase 5 and the restorations. Let's start with Phase 1, education. As I said, induce oral hygiene, brushing, flossing, mouthwash, everything in oral hygiene. Periodontal treatment, as we know, we should do scaling and root planing. And after, we make sure that the patient is ready and he is starting to take care of his mouth. Surgical treatment, we did here aesthetic crown lengthening and also implant placement. We put 3 implants in the lower left side, 2 implants in the lower right side. And I will start to talk about aesthetic crown lengthening. Okay. In this case, in the aesthetic crown lengthening, okay, if we try to draw a line from the highest point of the right canine, we can say from the zenith of the canine, okay, and compare it to the other side of the other canine, we can find that there is about 5 millimeters difference between both sides. And also there is about 3 millimeters from the highest point of the centers to this imaginary line. So there is many things we will say, okay, it is a huge gummy smile. What should I do? There is a big over eruption. There is about 5 millimeters at this side. Okay, it's overgrowth 5 millimeters. So I will take in consideration many things. I will take into consideration the bone support and the bone level and the crown root ratio. Of course, when we look to the X-ray, if we are going to remove 5 millimeters to get the golden proportion or the perfect smile, it is a huge quantity of bone. 5 millimeters, I will lose the support, and I will I will affect the crown root ratio, and of course, this will affect the prognosis of the final restorations I will make at the end. So I decided to minimize the gummy smile as much as possible. And without damaging the more bone, and of course keep the crown root ratio at the normal level. So if we take a look to the X-ray here, we can see that there is a pocketing, okay, in this area. So when we do the crown lengthening, we will eliminate the pocketing. And of course, I decided to remove 3 millimeters from this area above the canine, 4 or 5, which I have to minimize the gummy smile. And it is, for me, will minimize the gummy smile about 70%, 80% maybe. We will see in the next slide. And we did the crown lengthening. Of course, here, because of the papilla damaging, and we did internal vertical matrix sutures to preserve the papilla. And we make sure that the contact, the distance between the contact point and the bone level is 5 millimeters. This is after we did the crown lengthening. As we see, there's about 70%, 60 to 70% of the gummy smile. This is immediately after the crown lengthening. Phase 3, we are doing the endodontic treatment and build up and reconstruction of the teeth. As we see here, we did endo treatment, okay, and fiber post and build up of the destructed teeth. And unfortunately, I lost one of my implants. There was a failure, so I put a bone graft. There was no enough bone while I did this implant. So I put the bone graft, and I will wait for the future to remake another implant. In the upper arch, I did here endo treatment, fiber post, and I was in my plan to make veneers for the lower anteriors, but this teeth was eroded and there was attrition. So after I did the operation, I found that the patient has a high sensitivity, so I decided to make a crowns also for them. Phase 4, initial preparation and temporization. Here, as we see, this is 2 weeks after crown lengthening. We put a temporary CAD-CAM temporary bridge. This is after 2 weeks. And this is after 3 months. As we see, about 70 to 80% of gum spine has been eliminated. Of course, after crown lengthening, we should wait 4 to 6 months. At this case, I waited for 6 months because we removed a lot of bone. As we know, phase 5, after 6 months, we did the final processes, zirconia crowns done for the upper arch. And this is our crowns. The patient asked for a bleach color. And this is a follow-up after 3 months for the case. This is from the both sides. We can see the gingiva is pink, healthy. And this is what happened after 6 months. As we see, there's a pink gingiva. This is the before picture. As we see here, there is a huge gummy smile. And this is after. And as I said, we did crowns also in the lower arch and on the implants. This is another picture. There's many pictures for before and after because I have a message about it. And this is after 8 months follow-up. We can see that the gingiva is pink, the papilla is filling the triangles. There is another rule for me that the secret behind any success in the dental field is the pink gingiva. When we see this healthy pink gingiva, it is the secret behind any success in any cases. So, is it a life-changing case? For me, yes. Yes, it is a life-changing case, and the patient was very satisfied of her result. Just look at her eyes. This is the final result. And I hope you're gonna like it. And the last thing I want to say, sometimes between before and after pictures, there is a lot of efforts, exhaustion. So try to make it the after photo worth it. What will I show here is not a case of dental, it's a case of me, of one thing that happened in my life. It changed my life. This is me after I lost 50 kilograms. So try always to make the after photo worth it. This is how we do in our practice, and of course we will face many challenges, but we can move and overcome it. And of course, as I said at the first, always stay positive. Thank you very much, guys, and remember the message: stay home and stay safe. And this is a message from me and my beautiful wife, Iman, and this is my beautiful daughter, Sarah. Thank you, guys, and thank you, Dr. Hassan, thank you, Dr. Tamer, Victoria, Dr. Walid, everybody here. Thanks for this chance. I can't imagine that this is my first presentation I do in my practice and in my life. So I hope that you like it. And
I'm sure Walid will like it because you put the Barcelona shirt.
Yeah.
Now Walid is your best friend.
Oh, really?
There you go, Chelsea or whatever. Well done, Anan. Well done.
Truly,
thank you.
Truly great, Anan. Thank you so much. I love your message. It's absolutely right. There's a lot of stress and hustle and hard work in between the before and after, and we should not be fooled only by looking at beautiful pictures and miss out on all the teaching and education that we need to get in order to get there. So thank you for showing us that.
Thank you very much. Thank you for everybody here, and I think I finished on time. Is there any questions?
You did.
I can.
You have some questions.
Answer. Yeah, yes. I will answer it on the Q&A.
Please do.
Okay. But before you go, because I mean, I'd like to take this opportunity, everyone, to welcome a very good brother, good friend, partner in crime, as they say, Dr. Walid. Hello, Walid. How are you doing?
Hi, Hassan. How are you doing?
Dr. Walid.
Hi, Dr. Victoria. Hi, Anan. How are you?
Walid, as I mentioned earlier on, Walid is part of the Bird Academy. He's the head of the laser council. He's also a periodontist. And since your case involved some perio management, Walid, do you have any questions or take-home messages you want to give to Anan?
Yes, everything is okay. Just I like to see a periodontal chart in this case. Maybe I don't agree with the crown lengthening terminology for this case. The result is okay, it's perfect clinically, but here the patient has periodontal disease. So maybe we call it apically positioned flap to manage the periodontal disease because already has bone destruction and destruction in the periodontium. Just in terminology, but for everything, the clinical, it was done perfect. The timing, waiting the 6 months for the healing and establishing the zenith and the levels and the contour, everything was done. Great.
Thank you.
I was so pleased because when you first put the panorama and the photo, I mean, it looked so awful, the photo, and you've changed the life of the patient. I was like, please, Anan, don't take the teeth out, put implants. Please, make sure it's not an implant case. But then
no.
Showed, no, actually you preserved the teeth.
Yes.
And I think you've educated the patient and changed her oral hygiene. I could see that.
Yeah, it's a behavior management.
Perfect. Excellent.
Yeah.
Well done. Regards to everyone in Palestine, regards to you, Anan, and we look forward to continue the Bird Professional Diploma in Palestine soon after the COVID-19 pandemic stops. Have a great afternoon, my friend.
Thank you,
guys. Thank you, Dr. Victoria. Waiting for you. Thank you.